Okay, so this young man right here is having difficulty breathing. He's going to be breathing anywhere from 6 to 7 times a minute. Normally, when we get on scene as EMTs, we will try to insert an OPA. First thing we're going to always do is do our basic skills, which is what? Open the airway using modified jaw thrust. So we're going to do that. Then we'll get our OPA. We will measure it here. As we try to insert it, he starts to vomit. He starts to throw up. So that tells us he's conscious enough to where he might accept the OPA. So with the OPA, looped it up, we're gonna go inside his nair. As we're pushing down the NPA, we're also turning it, trying to get past the nasal septum. Once we get it all the way in, and these can be inserted in conscious patients. It also could be inserted with patients with a gag reflex. So once we do that, we're gonna come down, because we always wanna put our patient on 100% O2. So we got an oxygen bottle right here. We're gonna cut it on. We're gonna hook up our oxygen. We're gonna cut it on. We're gonna wait for our reserve bag to fill up. Once our reserve bag fills up, then we know we're giving this patient, our patient, 100% oxygen. So what are we gonna do? We're gonna use what we teach them in class. We're gonna use the C and the E technique. We're gonna go here. This lip right here goes right above the nasal septum. Using that C and E technique, we're gonna put the hands here. We're gonna put the other hands right here on the lower part, which is the mandible. And now we're just gonna breathe for him 10 to 12 times a minute. Watching his chest rise and fall, making sure we're getting that good air exchange, making sure the chest is coming up, making sure the lungs are filling up and going back out. Once we do that, now it's just for us, we're just gonna continue to monitor this patient to see if he actually starts to pick up, if his respiration gets better, if it gets to the point to where he might even start breathing some for himself. Usually with these type of patients, they just maybe just a little bit hypoxic from either what medication they're on, could have some other medical issues going on. So this is basically all the treatment that we're just gonna do for our airway segment today. So.